So I think the first thing that's really important is that the Centers for Disease Control is being very careful in making sure that any person who travels from any of the 3 countries in which there is Ebola disease circulating we have a way to know if they're coming into the country based on the fact that 95 to 96% of them come through certain airports. And we're actively screening through those airports and checking those people out as they come into the country. So if they have no symptoms, but they have been in one of those 3 countries, there are measures in place to follow them very carefully and help them to take their temperature daily and to monitor to see if they ever develop a symptom. So I think that's the most important thing, that if people are worried that there are many people coming into the country that we don't know about, the answer is no. And in fact, people that are coming to this country are actively being followed by their local health departments to make sure that they don't develop symptoms. If they did develop symptoms, then the health department would know, and they would be referred to a medical institution such as ours, which is very prepared to take care of these patients. And we would immediately place them in isolation so that they are not at risk of infecting healthcare workers or other patients. And we would support them with whatever they needed. So there's not a specific antiviral medicine for Ebola virus, but we know very clearly what these patients need, which is to monitor their fluid losses and give them fluid if needed, keep their temperature down with medicines that we use for any other reason that you would have a fever. If they have bleeding, to keep up with that. So it's really supportive care, but in a protected setting.